Stop recording. Okay. So our next presenter is Dustin Webb, and Dustin works in the Lincoln County Health Department in the 0 to 5 program. It's where he did his practicum. And his site mentor was Dory Rowland, who is the coordinator of the 0 to 5 program. And the name of Dustin's presentation is Lincoln County Connections, Increasing Public Health Accessibility in Rural Montana. Go ahead, Dustin.
Can everybody hear me okay?
Yep.
Okay, excellent. So again, my name is Dustin. I am a registered sanitarian with Lincoln County Health Department. As Lee said already, I did choose 0 to 5 as the program that I decided to follow. My site mentor is Dory Rowland. She is our local collaboration coordinator and also program lead for the 0 to 5 program here in Lincoln County. So just a little bit of background about what 0 to 5 is. So 0 to 5 is a childhood development program positioned here in Lincoln County. They got their start in 2019. I believe they are funded by the Headwater Foundation. So their purpose statement, just to give a little bit more background. So 0 to 5 Lincoln County strives for a county in which all families with young children are valued, connected, and empowered through community-supported families. By 2026, all families with young children will have experienced a meaningful engagement with an early childhood outreach effort or program. And so with this program that we'll get into a little bit later, so we wanted to solve one of the biggest hurdles that the majority of counties in Montana experience with public health delivery, and that's accessibility. So many of the counties have kind of a rural and frontier setting when it comes to public health delivery that includes sparse populations. Lincoln County has a total of about 20,000 residents spread out over a geographical area the size of Delaware and Rhode Island combined, just to give a glimpse at what that looks like. So lack of accessibility extends into services and programs, technology. We suffer quite a bit from dead zones when it comes to cell service. You know, the terrain is not great trying to travel around the county. So we sought out to fix that. And so that leads into the mobilization of public health. So what we decided to do in order to meet people where they're at is to establish a mobile resource van specific to public health. And so we in 2021, we received ARPA funding for the support of the mobile resource van. After receiving that funding, we did get a Ford Transit van. We didn't get that until 2022, which is when the program planning phase of that began. And so we'll get into that a little bit here. And so before we get into the deliverables, I think it's important to note that a lot of the work that was done with this program was intangible. So I attended various meetings. We had MSU nursing students approach us with the intent of helping us plan this process. We sent them out to kind of delve into similar programs throughout Montana, throughout the nation, just to get a feel for what it might look like for us. And so my first deliverable was a inventory survey. So I constructed a 17-question survey that was sent out to approximately 70 partners. They included kind of scheduling aspects, who would be interested in attending with us on the mobile resource van. We requested logos so we could develop magnets to be placed on the outside of the van to advertise partners in childhood development specifically. And so this survey will be used in the planning process, the scheduling process. We've already begun sending out schedules for events throughout the summer for the mobile resource van. And so in total, I think we've gotten 20 responses so far. And with that, so this survey will remain live as well. So it'll continue to circulate, collecting information from the various partners, which we will then use in the future. And so in addition to that, so once we received the 19 responses, I did kind of an evaluative document. It's not displayed here, but just kind of displaying what we're seeing, what's being requested, things that people need in terms of the resource ban. And that document will also remain live. So it includes graphs, statistics, all that jazz. And then my foundational competencies and the concentration specific competencies are displayed on the left-hand side. I don't think it's that important that I go through each one of them individually, especially considering the time constraints. So that was my first deliverable. Great responses, exceptional feedback, which we will incorporate into the launch of this program. And then for deliverable 2, so with that funding, we did also receive additional funding for the hire of 2 coordinators for this position. So one will serve under Lincoln County Health Department in general, and the second will be a program coordinator for 0 to 5 specific. And so I helped with the hiring process for the project coordinator that is specific to 0 to 5, and that included editing, interview questions, being on the panel, just being a part of the interview process in its entirety. And that was such a great experience. I had only been on the receiving end of interviews prior to this, so it was fantastic. And we got somebody hired. And so looking to the future, so we are currently working through the logistics of this mobile resource van, trying to figure out what storage looks like, upfitting, event scheduling. Like I said, we've already started the calendar process for the events that we plan to roll out during the summer. We are in the process of advertising and collecting communication from our different stakeholders. And so the picture on the right is kind of a preview of what the van will look like. So one of our employees with the 0 to 5 program drew this out. And just to kind of reflect back on the connections aspect of this van, we have the Kootenai Bridge here, a compass, kind of the environmental elements that make up our county. So it kind of ties everything in well together, I think. And so in addition to everything that we have done here, so my main role as a sanitarian is obviously the environmental aspect of public health. And so I wanted to include it as a deliverable for this project, but there were some delays. So we are currently seeking funding for an environmental health component that will be added to this van. So what we plan to do is kind of establish home safety kits to elevate the well-being within the residential setting. We plan to incorporate things like cabinet locks, lead testing kits, water quality testing, carbon monoxide monitors, if we can satiate that funding. And then the development of info cards, kind of a checklist to ensure adequate living environments for our community members here. And so for my community service, so I've been an EMT for Libby for about 4 years now. This is a picture of the crew that I run with. I serve 48 hours a month. And it is a very unique experience. Again, with the accessibility, it kind of leads into the premise of this project to it can be a little difficult reaching people in such a vast county. And so this image, I think, kind of drives the message home. So much of the work that I do in public health or environmental public health is analytic. And so one of the key takeaways that I got from this project is collaboration. So very much data-oriented mind, and to kind of have that creative aspect of this project really broadened my horizons. The children of this county are going to be the future leaders, and I think it's important to invest in them. And this mobile resource van will help us break down those barriers to inclusivity, the socioeconomic factors that are kind of limiting in this community. I think will be broken down by continuation. And so this mobile resource van too is a small piece of a much larger puzzle. So we have kind of a website set up that we can direct people to, and that's kind of where the Lincoln County Connections comes in. That'll be the name of the resource website for community members. And so we look forward to the launch. I think we're set for June. We may be a little delayed with the wrap and some of the logistics, but we will be up and mobile. And so that is the end of my project. I would like to thank Dory Rowland for her patience as well. She's been an excellent site mentor, and I look forward to continuing the work with this mobile resource van and her in general. And again, too, I would like to thank Kathy Hooper, my supervisor here at the County Health Department, as well as Jen McCulley. I'm not sure if she's on the line, but their instruction has been instrumental to my development, not only with this project, but with the MPH curriculum in general. That's all I got.
Awesome, Dustin. Thanks so much. Yeah, for